In this video, we will be looking at the SI joints. So the first image that I'd like to talk about is the AP axial SI joints. The AP axial SI joints require a 30 to 35 degree cephalad angulation of the central ray. And that's because of the anterior angulation of the sacrum itself, the way it sits angled in our body. So that central ray has to go into that angle at the lumbosacral junction. So it requires a 30 to 35 degree cephalad angle because of that anterior angle of the sacrum itself. The SI joints are formed here at the auricular surface of the sacrum, where it unites with the ilium of the hip. So that is why we have to create such an angle on our tube for this image. So on the sacroiliac joints, we want to make sure that we're not clipping from the side to side. So we'll scan our image from side to side and make sure we can see both sacroiliac joints. We want the sacrum and the median sacral crest centered on our image. This image shows the symphysis pubis because of that cephalad angulation of the tube. You can see the symphysis has been superimposed into the most inferior part of our sacrum here, but that's that cephalad angle projecting the symphysis pubis and the symphysis superiorly into that area. But that's okay because this is not a sacrum image. But this is a way that you can identify how much angulation is on the tube, is by watching what's happening at the pelvic brim here. So we can see the pelvic brim being closed up and foreshortened, and that helps us to identify that cephalad center ray angle. Another thing we can go to is that L5-S1 joint space is open as well. So we'll be able to identify the amount of angulation by that L5-S1 joint space being open, no superimposition of L5 on the base of the sacrum, and then that pelvic brim being foreshortened and projected, the pubis being projected superiorly. So this is what we're looking for, those full open SI joints clearly demonstrated in our AP axial SI joints. The central ray is going to be placed 2 inches inferior to the ASIS and down the mid-sagittal plane, angled 30 to 35 degrees cephalad. On the oblique SI joints, I wanted to compare these two images next to each other and kind of look more closely at the anatomy. So I'm going to highlight some areas here that I want us to be, aware of. I'm going to kind of show you this area in here where we can see a little bit of overlap of where the SI joint is showing here. I can see that there's a little overlap of the ilium here. Now, although we can identify the SI joints in there very clearly, there still is some superimposition of the ala of the sacrum. This is the ala of the sacrum and part of the ilium, kind of superimposing that area that's really of interest. So I just wanted you to be able to recognize that this image has less rotation than the image right next to it, where we can see a nice clear open SI joint all the way through, no overlap of the sacrum, because here this is the edge of the sacrum here, where it's articulating with the ilium. Then we can see the SI joint all the way through, clearly demonstrated, and then we can clearly identify the ilium separate from the sacrum. So there's no overlap of sacrum and ilium like we have on this first image that we were looking at here. So just a way to identify, which one is more rotated. So because this one looks a little bit more AP, and we see that little bit of overlap there, This one is not rotated as much. This first image is not rotated as much as the second one. So in this one we can have, say, might be slightly under rotated because we're not seeing that SI joint clear of superimposition of the ilium. And then this one would have a little bit more rotation and it opened up that area better, and we can clearly identify that SI joint a little better on this image. So for the oblique SI joints, we are going to have our center ray 1 inch medial to the upside ASIS. So in this picture down here, I'm showing you the pelvis and how they've rotated the patient into an LPO position, and we're able to see that right SI joint opening up with that LPO rotation. So this image we could say is an LPO for the right SI joint, and this one also is the right SI joint, an LPO position. The rotation of the patient's body is 25 to 30 degrees because that is the angle at which the ilium and the sacrum lie against each other to create that SI joint. So obliques are 25 to 30 degrees and rotation, and it would be LPO for right SI joint and RPO for left SI joint. Insufficient rotation is going to overlap the ilium and the ala, obscuring part of the SI joint. Over rotation would show a more narrow ilium because of the over rotation. So the more wide the ilium looks, the less it's rotated. The more narrow and foreshortened it looks, the more the patient is obliqued.